The beautiful rolling hills of Fall River County, home to about 7,500 residents, is classified as a frontier area. The sprawling county has just 4 persons per square mile. The community of Hot Springs, located in the northern part of the county, 60 miles south of Rapid City, offers the only healthcare facility in the county, Fall River Health Services. Fall River Health Services is an integrated system committed to providing the primary health services needed for the medical and economic health of our community. The system is centered around Fall River Hospital, one of 38 critical access hospitals in the state of South Dakota dedicated to maintaining and improving access to essential health service in rural areas. Fall River Rural Health Clinic, the hospital emergency room, and Castle Manor Nursing Home are also essential components of Fall River Health Services. Our community has demonstrated its commitment to ensuring that the residents of Fall River County have access to the medical care needed in a setting close to home. In 1999, Banner Health Systems elected to close Southern Hills Hospital Acute Care Facility in Hot Springs, leaving the community and surrounding area with no emergency services. With 28% of the county population over the age of 65 and the nearest emergency facility 60 miles away on South Dakota roads, it fell to the community to put their minds, hearts, and hands into the opening of a critical access hospital as well as an acute stabilization emergency room. On June 21, 2001, thanks to the vision and dedication of key individuals and strong community support, Fall River Health Services Board officially opened the Fall River Hospital and Emergency Facility. Fall River Rural Health Clinic is committed to providing high-quality primary medical care to the entire family. Our providers, Dr. John Connect, Dr. Heather Pruce, Dr. Bradley Plaga, Dr. Drew Purdy, and MP Jeanette Hoffman are available to meet our community's comprehensive medical needs.
We are committed to providing high-quality care. It is very important to us for the community to feel reassured and to have the knowledge of what services we have here in Hot Springs.
Fall River Hospital is currently a 13-bed medical facility and is licensed by the state and certified by Medicare and Medicaid. Our professional hospital team combines science, technical skills, and caring to assure the care given to each patient is appropriate and of the highest quality. Our vision is to be the medical center of choice for the citizens of Fall River and adjoining counties. The staff are prepared to meet your needs, from the unanticipated emergency to discharge. Our services focus on the needs and desires of the individuals and populations we serve. Services are added based on growth and the health needs of our community, while considering financial accountability and benefit for the future. We provide these services independently and through networking with other healthcare providers to offer the range of services needed. Both routine and emergency services are available. One area of expertise that we offer is the swing bed program, a Medicare Part A benefit that offers a subacute level of care to assist patients who are convalescing in their transitional home or at a permanent placement. Our radiology department offers diagnostic imaging in X-ray, ultrasound, computed tomography, and bone densitometry. We also offer mobile mammography and MRI services. All exams are read by board-certified radiologists in Rapid City. The laboratory at Fall River Health Services performs over 60,000 tests per year using state-of-the-art technology and instrumentation. Laboratory tests comprise an estimated 70% of a patient's medical record and are vital to the diagnosis and treatment of disease.
We do troponins on patients that come into the ER with chest pain. We can turn around the results in like 10-15 minutes because of the testing that we do here. We do microbiology. We set up urine cultures, sputum cultures, and the turnaround time has been greatly decreased because we do it right here, and the doctor can treat the patient so much faster.
A complete rehabilitation department offers physical, occupational, speech, and respiratory therapy.
We are a full rehabilitation department. It has been open with Fall River Hospital now for 7 years, but before that we've been here for several years. I work with generations of families. We don't just do patient care, we do family care. I'm currently working sometimes on my 4th generation. I've got ranchers that are out in the field. I work with their kids, I work with their grandkids, and it's you become a family member, not just a therapist or not just a healthcare provider.
The majority of surgeries performed at Fall River Hospital are outpatient procedures. General surgeons, a podiatrist, and eye surgeons are part of our credentialed staff and are available as needed for a variety of surgeries. Part of our goal to meet most of our community's healthcare needs right here. Cardiac rehabilitation is available on an outpatient basis. We work with private physicians to create individualized plans of care for cardiac patients. Most recently, an agreement has been obtained to perform diagnostic sleep studies. A licensed social worker, information systems manager, respiratory therapist, and revenue cycle manager offer important support services. The Environmental Services Department, including a biotech engineer, keeps the facility and all equipment in top order and manages the cafeteria where home-cooked meals are prepared for patients, residents, and employees. All our efforts are directed toward continually improving the overall health status of the community we serve. This is never more important than when there is an unanticipated illness or emergency. Time is of the essence, and services close to home are critical. Our physicians and staff are prepared to provide emergency treatment and stabilization for all ages. We work with a network of services and can prepare patients for transport should it be needed. Statistics show that a majority of visits to the emergency room would have required the patient to seek medical care elsewhere if the Fall River Health Services emergency room were not in operation. This alone is a major benefit to the community. The ambulance service in Fall River County is often challenged by poor road conditions and severe weather situations, as well as the remoteness of ranches and farms in the area. An exciting development is the availability of the Black Hills Life Flight helicopter. Several critical individuals have been stabilized and transported to Rapid City Regional Hospital.
Without this emergency department at Fall River Hospital, we would definitely see a higher rate of mortality among the citizens of Hot Springs and the surrounding area that utilize this facility. There's no doubt.
Fall River Healthcare Services has 48 beds available at the Castle Manor Nursing Home, with a daily average in excess of 95% occupancy. Excellent healthcare experiences for our patients and residents include access to the medications needed for recovery and daily living. Our full-time pharmacist is a key member of our interdisciplinary team. Studies have found that quality of life factors play a dramatic role in business and industry location decisions. Among the most significant of those variables are healthcare services. Healthcare services not only provide needed healthcare for current employees of area businesses, they also result in spin-off industry development. Several businesses have indicated that when the community had no hospital and emergency room, individuals were very hesitant to relocate to our community. Now, these businesses are able to recruit employees. The economic growth resulting from restoring and maintaining our healthcare facilities is impressive, but growth is not measured in numbers or dollars alone. None of us can put a value on a life saved or a life made more comfortable. The security of knowing that when the ravages of age catch up with us, we could live in our home community, or the importance of being able to secure physician consultation, diagnostic tests, or therapy without having to travel at least 60 miles one way. We've come a long way since the doors of our hospital closed in 1998. Fall River is the first and only critical access hospital in the state to reopen after being closed, the result of a determined community that pulled together. We not only reopened, we have thrived, growing from 45 to about 150 employees, adding the Fall River Clinic and numerous services so the people in our area can meet more and more of their health needs right here at home. But we've reached a critical juncture. The original building, now the nursing home, was built in 1917. The hospital was built in 1950. We've outgrown these buildings, and necessary growth to serve our population can't continue without more space. Moreover, the aging infrastructure has problems, including electrical wiring that is inadequate for today's technological needs, inefficient heating, cooling, and lack of a sprinkler system. Hot Springs native Bill Cox donated nearly 12 acres of land for a new healthcare facility. The ground was broken on the project in November 2008. The land has been appraised at more than $1 million. Local volunteer contractors worked with the city of Hot Springs to bring utilities to the property line, saving a significant amount that wouldn't have to be financed. This community teamwork, along with the equity in the land, made it possible to borrow the $20 million for the project which includes a new 25-bed hospital with a rural clinic and diagnostic services. Eventually, we plan to move the Castle Manor Nursing Home to the new site.
To this side, in about where that backhoe is at, and into that area is designed where the nursing home will eventually reside. That will be a separate project. That the financing of that isn't in place yet, so we split it into 2 projects, and phase 2 would be that, and it won't be very long before we'll begin going through the feasibility of making that happen. We're excited about the next step, moving into this facility and then continuing on with additional services that we can add at this campus. It's been instrumental in recruiting doctors to the area, new physical therapists, all the professionals in the health industry, and we're very excited that that will continue in the future here in Fall River County.
We moved into our 50,000 square foot, 25-bed state-of-the-art facility March 29, 2010. The community's use of our beautiful new hospital has exceeded our projections.
Now it is time to replace our aging nursing home. The Hot Springs Nursing Home has been designated access critical, and with pending legislation in the Senate, we will be eligible to go to 59 beds. Castle Manor Nursing Home is an essential part of care in the community, and the hospital and nursing home work closely together in discharge planning and diagnostic services. And when the 2 facilities are joined together, there will be many gains and efficiencies, such as staffing.
Our vision is that we need to continue to work together to ensure that Fall River Health Services will sustain top-notch health care for this community for decades to come. Please consider how you can partner with us to keep moving toward our goals.